And so it's with great pleasure to introduce our next speaker, Doug Martin, from Auburn University School of Veterinary Medicine. And our veterinary colleagues have been absolutely critical in this journey that we're all on to try and treat these diseases. And he's going to be talking about using intravenous approaches to gene therapy, again in GM2. So Doug, thank you very much for joining us.
So what I'm going to talk about today is intravascular or IV gene therapy for cats with GM2 gangliosidosis. And this is actually a model of Sandhoff disease. A lot of you have seen in some previous meetings, actually I'll just let you go ahead and advance that. A lot of you have seen in some previous meetings the results that we've talked about from direct intracranial injection of cats with gene therapy. So directly injecting the brain with a gene therapy vector and what kind of results we were able to achieve with that approach. These are a lot of lines, and we don't want to get bogged down in that, but basically this is a survival curve, and every time the line drops, that's the death of an animal. You can see that the untreated cats are represented by this black line, and they die very quickly, by an average of about 4.5 months. With our best treatment, the longest lived cats were able to survive an average of about 20 months. So our best surviving cats were about 20 months of age, and we even had a couple that lived out to 30 and 36 months of age. Not only did they survive longer, but their quality of life was a lot better, and that's represented by this clinical rating scale on the right. What you're looking at here is a clinical rating score that we give to each cat, where 10 is normal and 3 is the point where they can no longer stand and we euthanize them. The untreated animals, represented by these black diamonds, don't do very well at all. Their disease progresses very rapidly. The treated animals, treated by direct brain injection of gene therapy, do much better, and you can see that their disease progression is much more level and much better. One thing that this chart doesn't show is that the worst symptom for the cats is a pronounced whole body tremor, where they're doing like this, and they can't eat and they can't use the litter box normally like a cat would. All of these treated cats, regardless of their survival, had no whole body tremors. So that was a major advance for at least the quality of life of the cats. Next panel, please. Yeah, this little lady is named Montreal. She lived for almost 3 years of age, the longest living GM2 cat ever. She was directly injected in the brain with gene therapy. So that's our gold standard. That's what we're headed for. And we want to try that and see if we can achieve similar results with a simple IV injection. Next slide, please. All right, one of the problems with the intracranial approach is that it's complex, and I'm not going to go through all the methodology here, but I put these up, all these details up, to show you that it's a complex procedure. It's not something that's really easy. We have to use what's called a stereotaxic apparatus to make sure that the injection needle is held in a precise position in space so that we're injecting exactly where we want to inject in the brain. It's not something where you can just hold it in space with your hand and inject. The injection procedure happens over a period of about 90 minutes. So it has to be held right where we want it to be held for a prolonged period of time. Lots of times we also have to use ultrasound to guide the needle exactly where we want it to go. So we would like to be able to do something that makes the injection procedure itself a little bit easier. Next slide, please. Another image, if you can just click on right here on the little arrow that should come up. Yeah, this shows the vasculature of the cat brain. That big orange pulsing thing is a vessel that we are absolutely terrified that we're going to hit during injection of the thalamus. This is the thalamus of the cat brain right here. So we have to come in through that vessel and avoid it. That's another thing that you really don't want to have to deal with in kids if you can avoid it. You may not be able to avoid it, but if you can, it would be great. Next panel, please. This is what happens when you nick one of those vessels going in to inject the cat brain. You end up with a bleed in the thalamus. This particular animal circled around to the right over and over and over again. It couldn't see for a period of time, and it was basically obtunded, just didn't know where it was. We treated it with supportive therapy, and it recovered within a week's time, and it has lived for a long, long time and actually produced many litters in our colony. So he did really well, but it's still something that you would like to avoid if you can. Next slide, please. The other thing that we found out is that if we could delay disease or treat the disease in the brain and spinal cord really well, we ended up having disease in the peripheral organs. In these cats that are untreated, they never live long enough to develop peripheral organ disease. But in the animals where the central nervous system is corrected well enough, they start to have problems in the peripheral organs, like they have grossly distended bladders. Urine volume is about 5 times normal in the bladder compared to compared to a normal cat. They have a spinal cord compression that causes problems. They have enlarged hearts, liver pathology that we can't take care of. All of this develops because the animals have been able to survive long enough to get to the point where it actually shows up clinically. Another thing that they have is this really dramatic distension of the stomach. And all of us know from having eaten Easter dinner recently that that's very uncomfortable. It's not something you want to deal with on a daily basis. It's another thing we'd like to be able to treat by perhaps an IV injection that will treat the periphery. Next slide, please. All right, so this is an image of the blood-brain barrier, which we already talked about. Carol already talked about the blood-brain barrier to us. We thought about using an IV injection of gene therapy to treat the peripheral organs, but we wondered about the blood-brain barrier. Would it exclude gene therapy the way it excludes purified enzyme? Next panel, please. Several papers have been reported recently or pretty recently that show that gene therapy vectors, if they're the right type of gene therapy vector, they can get across the blood-brain barrier and perhaps treat the brain as well. So we were really excited about that. We wanted to take a two-pronged approach to try to treat the peripheral organ disease and perhaps treat the central nervous system by an IV injection. Okay, next panel. And as far as the methodology goes, it's much simpler to do an IV injection than it is an intracranial injection. Now, most of you will realize that this is a little bit of a staged photograph, okay? If this cat were actually being injected in the cephalic vein, it would not be sitting there looking so sweet. We would have to sedate the cat, and we often do for the IV injection. Still, it's a much easier procedure. Next slide. So what are the results? Again, this is our clinical rating scale where 10 is normal, 3 is the score at which we have to put the animals down because they can't stand any longer. These are normal cats along the top line, so they're normal throughout the period of the experiment. The gray diamonds represent untreated Sandhoff cats, and you can see that their disease progression is fairly rapid. We think that we pushed out the onset of disease and the progression of disease by about 6 weeks with the IV treatment, and that's represented by these red and blue lines here. Certainly not as good as the direct intracranial approach, but not a complete failure either, and we'll talk about some more positive results in the next few slides. Okay, next slide, please. This is an MRI done by Dr. Edwards, who's in the audience. She does all the MRI work for us on cats and sheep and anything else that she can get her hands on, including pigs. But anyway, we'll talk about that later. What we're actually looking at here is the white matter of the brain, and it shows up as these dark projections into the cerebral cortex. In a normal cat, that white matter is really pronounced and dark. In an untreated Sandhoff cat, the dark areas actually change intensity and become light-colored. And that's indicative of myelin loss in the brain. It happens in cats, it happens in people. It's very indicative of the disease process. In the IV-treated Sandhoff cats, there is some preservation of the white matter in the brain. It's certainly not what we would hope for. It's not as good as the direct intracranial approach, but we've made some progress towards correcting that myelin loss after IV injection. Next slide. This is MR spectroscopy, which Heather spent a lot of time and effort working out. 5 minutes, thank you. Did you say 25 or 5? Okay. This is MR spectroscopy. So you use an MRI machine to look at different molecules in the brain and the levels that are there in the brain. Are they normal? Are they abnormal? We won't go through each one of these, but let's just look at N-acetyl hexosamine. Normal levels of N-acetylhexosamine are like this. Untreated Sandhoff cats have about 5 times the levels of N-acetylhexosamine. The IV-treated Sandhoff cats have intermediate levels of N-acetylhexosamine. So it's all the same picture. Everything, all of our pieces of data are sort of coming together to give us the same idea. Next slide. We looked at biomarkers in the cerebrospinal fluid of these IV-treated cats. AST and LDH are enzymes that we have previously shown to be elevated in untreated Sandhoff cats. With time, the levels of AST go up in untreated cats. These are normal levels, normal levels. We really haven't done much to correct the levels of AST and LDH in these IV-treated cats. Again, same kind of thing. We may be making some progress, but we haven't corrected these biomarkers to a level that we would like. Next slide. One thing that surprised us was we found quite a bit of enzymatic activity in the spinal cord after treating these cats by IV injection. What you're looking at here is a normal spinal cord stained with a particular substrate that turns red in the presence of hexosaminidase activity. So this is a normal level of hexosaminidase activity in a cat's spinal cord. This is an untreated cat with GM2 gangliosidosis, and then these are 7 different slices of the spinal cord ranging from the cervical region through the thoracic region through the lumbar region, stained for enzymatic activity. And as you can see, there's quite a bit of enzymatic activity in the spinal cord. So that's something that we can really focus on and exploit in our future studies. Really much more positive result than we expected from the clinical progression of the cats. Next slide. So one of the things we were trying to do was test the ability of IV gene therapy to treat the central nervous system. The other thing we wanted to look at was the ability of IV gene therapy to treat the peripheral organs. And so we looked at hexosaminidase activity in the livers of these IV-treated cats, and we're seeing about 40% normal activity, which is really great. If we can get that hexosaminidase activity back up to 40% normal in the liver, we'll be really happy compared to the untreated Sandhoff cats, which have almost no activity. One last thing that was positive in terms of a peripheral perspective is, next slide, the level of storage in the urine. Untreated cats have molecules called glycosaminoglycans in the urine. It's a type of storage material, but it's at very low levels. The untreated Sandhoff cats have about 5 times that much GAG material or storage material. And then the IV-treated cats have an intermediate level, somewhere between normal and untreated. Again, the entire picture is sort of giving us the same answer, which is we're making some effect, but not as great an effect as we would like to have. I think this is very worth pursuing long term, and so maybe the best news that I have to give you this afternoon is, please next slide, that the NIH agrees with us. We just learned a couple of weeks ago that NIH is going to fund a 5-year project at about $3 million to study intravenous and CSF-mediated injection. Thank you. We'll be looking at both IV and CSF-mediated injection of gene therapy to treat the disease. We have a lot of high hopes for this. This is between my lab, my group at Auburn, Miguel's lab at UMass, and Tom Seyfried's lab at Boston College. So we are really, really excited about that. I think we'll have an idea within a couple of years whether this is going to be a clinically viable approach or not. So I don't really think it's going to take 5 years to get there, but that's where we are right now. So be happy to answer any questions at the round table, and thanks for your attention.
Thank you very much, and congratulations on that grant. Again, it shows how seed money from NTSAD can lead to this much, much greater funding, and we very much look forward to seeing how that project progresses.